every year, more than 795 people in the United States have a stroke. And for us here in the greater West Bloomfield area, I think this issue came to light when Dan Gilbert suffered a stroke a couple years ago. It started the conversation going. And with us right now is going to be Cathryn Guina. She is a nurse over at the stroke program coordinator and the stroke program coordinator for the Henry Ford West Bloomfield Hospital. Thank you so much for being with us.
Thank you so much for having me.
And that's one of the things when Dan Gilbert suffered his stroke, he was fortunate enough to receive help almost immediately, which has helped aid in his recovery. But I believe when you have a high profile person such as himself, who means so much to the business community here in the Detroit area, it allows us to start that conversation. For you, you live on the front lines of dealing with so many people with stroke victims. What do you want the public to know? Starting off with, what are the signs to look for?
Yeah, absolutely. This is a really, really important thing for everybody out in the community to know the signs of a stroke. So we use the acronym FAST, F-A-S-T. F stands for face. Your one side of your face droops down. Your smile might be uneven. The next is A, that's arm. Typically, one side of your body is more weak than the other when you're having a stroke. So you test to hold your arms out and see if one arm is weaker than the other, or if when holding it out, your arm drifts down without intention. And S stands for speech. If your speech is slurred, garbled, you're having a difficult time processing thoughts or getting speech out. And then the last T is for time. And that's the most important thing, is that stroke is a true medical emergency. If you're experiencing one of those symptoms, the most important thing to do is call 911.
And with that, if someone thinks, like, is there a difference between a mini stroke? We hear that term, mini stroke. What exactly is that, and how is it different from a full blown on stroke?
Sure. So a mini stroke is also called a TIA, and the difference between the two is that with a mini stroke, your symptoms usually resolve within 24 hours. A lot of the time, most people's symptoms last, just a few minutes, maybe an hour, but then it goes away. And the important thing about TIAs is that a great amount of people end up having a full-blown stroke after a TIA. So instead of calling it a mini stroke, looking at it as a warning stroke is a good indication. It's also treated the same as a medical emergency if you come to the hospital with those resolved symptoms. The goal is to figure out what are your risk factors for having a stroke. So getting a hold of your blood pressure, high cholesterol, managing diabetes, having some kind of lifestyle changes to be healthier and decrease your chance of having a full-blown stroke.
And Cathryn, during the COVID-19 crisis, so many people have not wanted to go to the hospital. In this case, they need to go to the hospital.
Absolutely, every time. There are two different treatments that we offer at Henry Ford West Bloomfield for the treatment of acute stroke, and both of them are very time sensitive, just hours from the start of symptoms. So it's important to especially call 911. EMS has lots of connections with the hospital, and as soon as you arrive to the hospital, there will be a team in the emergency department to whisk you away and to really expedite the process to diagnose and treat your stroke. Everything at the hospital is still very safe. I know that COVID creates a lot of fear and panic and anxiety, but the hospital is still safe. Everybody wears a mask. Everybody is screened on their way into work. Everybody that comes into the hospital is also screened. So still really important, if you need urgent medical attention, to still come.
Cathryn Guina with us on the Oakland County MegaCast. She's a nurse and the stroke program coordinator at Henry Ford West Bloomfield Hospital. And Cathryn, you mentioned when we discussed symptoms that time is critically important in treating stroke. For those that may either experience stroke themselves or see the symptoms in a loved one or someone that they're working with, or just in the general public, how important are those minutes, and what those minutes, those seconds, those hours, and how much of a difference can they make both in the treatment of stroke and then ultimately the recovery as well?
Time is everything for both of those things. Like I had mentioned, the couple treatment options have to be within hours of symptom onset. So recognizing those symptoms and getting to the hospital right away is very, very important. And the quicker the stroke is treated, the better the outcome. So everybody, EMS, quick recognition when you come to the hospital, and then expedited care. Strokes are a true medical emergency. So when you arrive here with signs or symptoms of stroke, everything moves very, very quickly. Millions and millions of neurons, brain cells die every minute that you're having a stroke. So of course, it's very important to stop that process if possible, and then get right on the road to recovery.
And Cathryn, what causes a stroke?
That's a great question. So there's two types of stroke. The more common stroke is called an ischemic stroke, and that is when a main blood vessel in your brain is blocked by a clot. So oxygen and good blood can't circulate through your brain, which causes those symptoms. And the other kind of stroke is a hemorrhagic stroke. So that's when that blood vessel in your brain has too much stress or pressure put on it, and it just bursts. That's most likely due to high blood pressure or hypertension. And ischemic strokes, the more common ones, can happen for a number of different reasons. Having uncontrolled high blood pressure, high cholesterol, uncontrolled diabetes, a history of clotting disorder with your blood. So strokes can happen for a number of reasons, and the most important thing is to look at your risk factors, figure out what would put you at greater risk for having that stroke.
And with that, and knowing that, I would think there are precautions that any person can take in just the way that they live their life to try to avoid becoming a victim of a stroke to begin with.
Absolutely. There are only a few risk factors that you can't control. So that's the good thing. The ones that you can't, your age, the more you age, the greater likelihood of having a stroke. So that's just kind of an unfortunate thing about that. Gender, women are more likely to have stroke. And family history of stroke, you can't control that risk factor. So my grandfather had a stroke, so that I know that I have a family history of stroke. So making sure that especially my parents and myself and my family members, as we get older, constantly looking at the other risk factors that we can control, like high blood pressure, high cholesterol, obesity, having a healthy diet, a nice well-rounded healthy lifestyle, exercising, making sure to follow with a primary care doctor to kind of take a look at the big picture.
If someone is diagnosed as suffering a stroke, what is the treatment, and can some of it be permanent damage?
There can be permanent damage from a stroke. There are a couple treatment options. If the stroke symptoms are identified quickly, there's a medication called Alteplase. It's also called TPA, and it's a medication that's given through an infusion, and the goal is to dissolve the clot that is lodged in that vessel in your brain. So there's a handful of other qualifications that the person that's having the stroke has to meet, but like I said, it's usually given within 45 minutes of arrival to the hospital. And then if it's determined that clot is just going to be stuck in a very specific part of the artery, there's a procedure where a physician can actually thread a wire up into that vessel and remove the clot from your brain. So those are the two treatments, and then from there, Everything else that's done is based on all the other symptoms that the patient is experiencing.
Cathryn Guina with us on the Oakland County MegaCast, nurse and the stroke program coordinator at Henry Ford West Bloomfield Hospital with us on the show today. And Cathryn, there's a number of programs at Henry Ford West Bloomfield Hospital that that can help in prevention or help in treatment of stroke. What are some of those programs that are available, and how can people access them?
So at Henry Ford West Bloomfield, patients that come in that are diagnosed with stroke, there is a post-stroke clinic, a stroke neurologist that is able to see patients after they're discharged. I myself, follow up with patients at 7 days and 90 days, especially if they've had one of those procedures to abort the stroke. And then everybody is recommended to, continue following with their primary care physician. At that point, a lot of stroke patients need some rehabilitation. So sent to an inpatient rehab unit or a subacute rehab for a little extra help and focus on gaining back physical mobility, cognitive restoration, just getting back to having good quality of life afterwards.
Cathryn Guina with us here on the Oakland County MegaCast. She is the stroke program coordinator over at Henry Ford West Bloomfield Hospital. Just a couple more minutes with you here on this show. Anything that we didn't ask that you are the expert in your field that maybe we didn't ask that you want others to know?
I think the most important things you have definitely touched on already. Stroke is a true medical emergency. Sometimes the symptoms don't seem very severe, but in any situation, I think it's important for everybody to call 911 right away. Come into the hospital. You'll be safe here, well taken care of. A lot of really, really great stroke care being done in the community right here.
And if someone does suffer a stroke and they survive it, are they more likely then to have another stroke later?
Yeah, so that does happen. That's another one of those risk factors that you can't control. If you have had one, you could have another. Your likelihood of having a second one is greater than somebody who hasn't had one before. But again, after having a stroke, you're placed on specific medications to kind of manage everything else that could be happening in your body that would contribute to having another stroke.
And with that, quickly, if someone is admitted to the hospital, what are your visitor procedures right now with COVID?
So with COVID, all visitors are screened at the front door, which means a number of questions, your temperature taken. All visitors have to wear a mask. And I'm not sure what the hours are for visiting in urgent situations. There are exceptions, and the nursing staff, if you're visiting a patient on a specific unit, would definitely be the people to go to for that.
Cathryn, thank you so much for being with us. We so appreciate your time and all your expertise as well. It's so important for people, as you said, to get help and to do it sooner rather than later, because the quicker they act on a stroke, the less likely they'll have long-term disability from that stroke.
Yes, exactly.
Well, thank you so much, and thank you to you and the entire team over at the Henry Ford West Bloomfield Hospital. We appreciate your time today.
Thank you so much.